By Darius Spearman, African Elements. Support African Elements at patreon.com/AfricanElements to hear recent news in a single playlist. You can also gain early access to ad-free video content. A new federal bill is raising alarms among health equity advocates. The Embracing Anti-Discrimination, Unbiased Curricula, and Advancing Truth in Education, or EDUCATE Act, sponsored by North Carolina Congressman Greg Murphy, would prohibit medical schools from receiving federal funding if they have offices of diversity, equity, and inclusion, DEI, WRAL. Moreover, this legislation is part of a broader conservative push. The goal is to ban DEI programs at public universities across multiple states, best colleges. However, medical professionals argue that DEI is essential for combating the Black maternal health crisis. Black women in the U.S. face unacceptably high rates of maternal morbidity and mortality. This is due to structural racism, the Century Foundation. In response, many medical schools have implemented DEI programs. These programs train diverse physicians, incorporate anti-racism into curricula, and advocate for marginalized patients, PRISM. For instance, the UNC School of Medicine has robust DEI initiatives. The school is ranked 6th in NIH funding among public universities, UNC Healthcare. However, these initiatives could be jeopardized by anti-DEI policies, WUNC. As one UNC medical student explained, banning DEI would be disastrous for the diverse communities we serve. These programs are critical for building trust, providing culturally competent care, and ultimately saving lives. NC Policy Watch. Comparison of severe maternal morbidity rates between non-Hispanic Black women and non-Hispanic white women, indicating significantly higher rates for Black women. Severe maternal morbidity is also a major concern. For every maternal death, 100 women suffer a severe obstetric morbidity or undergo a life-saving procedure, NCBI. Furthermore, non-Hispanic Black women have the highest rates for 22 of 25 severe morbidity indicators used by the CDC, NCBI. Tragically, more than 80% of pregnancy-related deaths in the U.S. are considered preventable, CDC. Additionally, counties with high Black physician representation had lower mortality disparities between Black and white residents, CHEST. This underscores the importance of diversifying the medical workforce. Infants born to Black, American Indian/Alaska Native, and Native Hawaiian/Pacific Islander women also have markedly higher mortality rates, KFF. These sobering statistics highlight the urgent need to address systemic racism and inequities in healthcare. Experts recommend several strategies to combat the Black maternal health crisis. Improving access to quality prenatal and postpartum care is crucial, NCBI. Diversifying the medical workforce and implementing community-based interventions can help reduce disparities, NCBI, JHU Public Health. However, proposed anti-DEI legislation could jeopardize these efforts. As more states consider these bills, pushing back and emphasizing that inclusion is non-negotiable for advancing health equity is critical. While the EDUCATE Act is still pending in Congress, several states have already moved to restrict DEI. The North Carolina Senate recently overrode the governor's veto of an anti-DEI bill, WRAL. Additionally, the UNC Board of Governors Committee passed a policy threatening to eliminate DEI staff positions, NBC News. As more of these bills gain traction, experts warn they could roll back hard-fought progress on health equity. Solving the Black maternal health crisis requires a multi-pronged approach. Diversity in medicine and medical education is a key piece of the puzzle, said Dr. Rachel Brevel, JHU Public Health. In summary, the medical and public health community is pushing back against anti-DEI efforts. They emphasize that inclusion is non-negotiable when it comes to advancing health equity. The stakes could not be higher as this battle plays out across the country. About the author. Darius Spearman has been a professor of Black Studies at San Diego City College, where he has been pursuing his love of teaching since 2007. He is the author of several books, including Between the Color Lines, A History of African Americans on the California Frontier through 1890. You can visit Darius online at africanelements.org.